Good afternoon, folks. As you're logging in, if you could just take a second and sign in using the chat feature, your name and your federal agency. It helps us keep track of who is part of the session today. All right, so we will continue to admit folks as they come into the waiting room. For those of you that came in after I just said it, if you could go ahead and sign in using the chat feature with your name and your federal agency. So my name is Paige Farmer, and I am with the Combined Federal Campaign in Southern California. I'm only going to briefly be on your screen, and then I'm going to disappear off of it. I want to welcome you all here today for the session on health and well-being. We have a great panel. I think it's going to be a really good discussion. So my role here right now is just, we have discovered along the way a couple of tips and tricks for viewing, optimized viewing in this setting. So first of all, everybody's camera should be off so that the only cameras on are the panelists. And so what we recommend to folks is to, hang on one second. What we recommend to folks is you'll, instead of having all of those little empty dark boxes with the camera and the line through it, if you hover over any one of those boxes, you're going to see 3 dots appear. If you click on that and you click hide non-video participants, everyone whose camera is off, their little boxes will disappear off your screen. And if you put it in gallery view by clicking view in the upper right-hand corner of your screen, what you should see miraculously and hopefully will be just the panel and Kathy as your moderator on the screen with no other distractions. So that's our tech tip. I see that some folks have signed in. If everybody could take a minute and sign in using chat with your name and your federal agency, that's really helpful for us. And so with that, I'm going to turn it over to my colleague, Kathy Morris, who will be your moderator today.
Thank you, Paige. My name is Kathy Morris, and I am an Associate Director for the Southern California Combined Federal Campaign. A brief overview of CFC. We are the only workplace giving campaign for federal agencies established in 1961, raised 8.4 billion thousands of charitable organizations around the zone, country, and world. Given the weird virtual world we live in right now, we wanted to help create opportunities for federal employees to hear from and interact with these charitable organizations, and so created these series of lunch and learn events. Our session today focuses on health and well-being. At least half of the world's population does not have access to basic health care. More than 16,000 children under the age of 5 die every day. Many from preventable causes. Support for global health include increased access to healthcare, training healthcare workers, distribution of nutritious food, and a host of other services to improve worldwide health for all. 6 in 10 adults in the US have a chronic disease, and 4 in 10 have more than one. Heart disease and cancer are the leading 2 causes of death in American adults. Only 1 in 3 children are physically active every day, and less than 5% of adults participate in 30 minutes of physical activities each day. Only 1 in 3 adults receive the recommended amount of physical activity each week. CFC charitable partners are on the front lines every single day, and we are pleased to announce and to introduce our 4 of them today. And I'd like to go ahead and introduce them by their names and their agencies. Today, we have Michael Bigley with St. Jude's Children's Hospital, Shannon Bledsoe with WCG Cares, Nick Dismore with Special Olympics Southern California, and then Kathleen Ramsey, Bright Focus Foundation Alzheimer's Disease and Research. So each panelist now has 3 to 4 minutes to introduce themselves and describe their organization. We like to thank you again for participating in this panel. And I'd like to give you a couple minutes to introduce yourself, your organization, and the work that you do. Um, Michael, please go ahead.
Perfect. Thank you so much, Kathy, and incredibly grateful to have the opportunity to share St. Jude Children's Research Hospital with you today and share about the life-saving work that you make possible through contributions with the CFC campaign. On behalf of our St. Jude patients and their family, I just want to say thank you for your support, because what you do when you support St. Jude is you're helping change the lives of thousands of children and their families, because you're helping advance the work here at St. Jude, and that makes sure that no family ever receives a bill for anything, not for their treatment, their travel, their housing, or their food while they're being treated here at St. Jude. You're also helping expand our research and our survival rates for childhood cancer. And that just goes to show that when the hospital opened in 1962, that survival rate was 20%. And today, that survival rate is 80%. And we're focused on getting to 100%, and we won't stop until we get to the point where no child ever dies from cancer. And so I just know that just being a part of the CFC really helps make sure that we continue the work that we do. And that's why St. Jude Children's Research Hospital is here, because of the generous donors that give back and give generously. When I think about St. Jude and the dream of our founder, Danny Thomas, he was struggling, and he was a struggling entertainer, and he was down on his luck. And he prayed to St. Jude to say, "Help me find my way, and I will build you a shrine." And Danny fulfilled that dream, because we all know about St. Jude today. But a part of his dream was to make sure that no child was ever denied treatment based on their race, their religion, or the family's ability to pay. And that was his dream in the 1950s, in a place, in a country which was very segregated. And he built a hospital, opened up to everyone in the segregated South. And we were the first children's hospital fully integrated in the South in 1962. A lot of people would have told Danny Thomas he probably was crazy and that his dream was impossible. But to see the work that he did, and so many people come behind us to help give back and help further our mission, what was thought impossible is definitely possible. And we see that in our success with our research and our cure rates to helping save lives. And I know today we're going to talk more about some different topics, but I just want to say thank you again for the support that you give, because you're helping ensure that, when a child is diagnosed with cancer, here in the US, because of St. Jude, 4 out of 5 children will beat their battle with cancer, and they'll survive. Outside of the US, it's a little different, and 4 out of 5 won't win their battle. And that's why St. Jude is expanding our efforts to go globally, because there's over 400,000 children that are diagnosed with cancer each year. And we want to make sure that everyone has access to our research that we freely share. And how do we save more children that are battling cancer every day? So with that, Kathy, thank you so much.
Thank you, Michael, for being here today and sharing your story, and also sharing what you do with your charitable organizations. Thank you. Shannon, can you please go ahead and introduce yourself and also your organization, please?
Thank you, Kathy, and hi, everyone. We are really grateful to be invited to join you here today and to share a little bit about what we do. And I'm going to try and share my screen if I'm that talented. We'll see. Are we seeing that?
Yes.
Okay, great.
Looks good.
Thank you. So my name is Shannon Bledsoe, and I'm the Executive Director for WCG Cares. We are an international nonprofit organization based in San Diego, California, and working in low and middle income countries around the world. And our mission is to empower women and girls with the information and technologies that they need to make informed choices about their reproductive health. And we do that by partnering with women, with ministries of health, and with other locally based nonprofit organizations around the world to introduce new and improved methods for voluntary family planning and HIV prevention. The problem that we want to address is the issue of access. We believe that women deserve access to innovative technologies to protect themselves from unintended pregnancy and from sexually transmitted infections like HIV, no matter where they live. And the reality is that many women globally have limited access to the knowledge and tools that they need to do that effectively. For example, more than 218 million women say that they don't want to get pregnant, but they aren't using a modern method of contraception. And for a lot of women, that's because there isn't a method available that meets their needs. And as we know, the consequences of not finding a method that works for you and of experiencing an unintended pregnancy can be really severe. It can mean the difference between being able to go to school or having to drop out. It can be the difference between being able to care for the children and families that you already have or not. And it can also mean higher rates of injury and death for women. Another issue that's really important to us is HIV. According to the most recent UNAIDS estimates, every week more than 5,000 young women between the ages of 15 and 24 becomes infected with HIV. So it's easy to forget that HIV is still an issue. It's not in the headlines a lot lately, but that's a really staggering number when you think about it. So it's really important that we continue to make the most effective technologies available to give girls and women choices about how to protect themselves if they choose to do so. An example of one of the things that we're working on with our partner, the Population Council, is an acceptability study in South Africa for a birth control pill that also prevents HIV. And we're really excited about the potential impact of that. When a variety of contraceptive methods are available, women who want one are more likely to find one that meets their needs. And if women's needs were met in this regard, unintended pregnancies would drop by more than 70%, and both maternal and newborn deaths would fall significantly. And the gains that we would see as a direct result of that are less poverty, higher rates of education, women who are able to take care of their families and communities that can thrive, and less burdened health systems. This is our first year with the CFC, and we are really happy and excited to be part of it. There are so many good causes to choose from, and all of the organizations that are part of this campaign are so grateful for your support, no matter who you choose to support. For WCG, donations from the CFC will help us to make family planning and other health products available to more women, especially as some of our traditional funding sources have been less available because of the pandemic. We rely more on donors like you. So we'd like to thank you so much for your interest in supporting any of the causes that are important to you, and thank the CFC for giving us the chance to be part of this campaign. Thanks,
Thank
Kathy.
you. Oh, you're welcome. Thank you, Shannon. Very interesting. And we'd like to thank you for, becoming one of our panelists today and for sharing your story about your organization. So thank you for being here today with us. Nick, can you go ahead and share us a little bit about your organization, please?
Yes, thank you, Kathy, and thank you
Nick.
everybody for being here today. We really appreciate your support. I'm joined by one of our athletes, Jenny Skinner. Jenny, do you want to say hi real quick?
Say hi.
Hi, Jenny.
So, Special Olympics was started back in 1963 by Eunice Kennedy Shriver as a day camp to give people with intellectual disabilities a chance to compete just like everybody else was. And back then it started with 1,000 athletes, and today SOSC specifically has over 40,000 athletes that we service, a lot of which come through our schools programs. So we accommodate people from ages 2 up. So we have a wide net. We try to help as many people as we can. We serve from San Luis Obispo all the way down to San Diego County and everything in between. We are a year-round sports organization, and that's what we try to stress more than anything, is that we're a sports-first organization. We're the largest organization in the world with chapters in 158 different countries. We have local events from summer games and small game and fall games where our athletes come together and compete. And in 2016, we hosted what's known as World Games, where Special Olympics athletes from all over the world came to UCLA to compete in various sports. We offer 13 different sports right now, with more on the horizon. And obviously, when COVID hit for a sports organization, everything changed. We couldn't compete in person anymore. We had to shift to this virtual world that we're in now, but we're doing what we can. We're trying to help keep our athletes engaged through various virtual events, but your guys' support is really what helps keep us going. So thank you so much, everybody, for being here. Thank you, Kathy and Paige, for setting it up, and we look forward to sharing our story with you.
Thank you, Nick and Jenny, for giving us a brief overview of your organization. It's very interesting. So we'd like to thank you from CFC for coming and speaking with us today.
Kathy, Jenny has a short speech.
Please.
For the past 39 years, Special Olympics has been an important part of my life because I am with friends having fun and testing my skills in sports with hopes of continued personal improvement. I have trained and competed in many sports, but my favorites have been swimming, equestrian, skiing, golf, bowling, and bocce. It's amazing that one woman's vision has changed the lives of so many children and adults worldwide. Athletes gaining self-confidence and become part of their communities. Not only do the athletes feel their lives are enriched, parents also make lifelong friends among the Special Olympics family. I became a global messenger in 1992. Since then, I have spoken with many groups, including UCLA, USC, UCI, the IRS, and the FBI. I hope to see Special Olympics continue to grow and give many other athletes the same opportunities I have enjoyed. Thank you again for giving me this opportunity to tell you why Special Olympics is important to me. Thank you.
Thank you, Jenny. That was wonderful. Thank you. That was wonderful. You did
You're welcome.
You did such a great job. We appreciate that. Thank you for joining and coming to speak with us about your story. It was just fantastic. It was very heartwarming. Thank you. Kathleen, can you please speak about your charity?
Yes. Thank you for having me as well.
Thank you.
Great to hear everyone else's story and learn about your organization. So I am the manager of corporate and foundation relations at Bright Focus Foundation. Bright Focus is a unique organization in that we focus on 3 different diseases. And 2 of the diseases are vision related, macular degeneration and glaucoma. But our biggest program centers around Alzheimer's disease. And our Alzheimer's disease research program is the program that is associated with the CFC and the number. But to explain, if you're interested to learn about our vision programs, you can always log on to brightfocus.org to get more information. Our mission is to fund scientific research worldwide and provide expert information on these 3 diseases. Alzheimer's disease is a growing problem because as a whole, as a population, we are aging. We have a very large baby boomer generation, and about 10,000 people each day are turning 65 in this country. And 1 in 10 people over 65 and over will develop Alzheimer's disease in their lifetime. So that's 10%, you know? So it's pretty staggering when you think about it. And that equates to about 5.8 million people in this country. So what are we going to do about it? Well, research and science is the only way to make progress towards this disease. And as we know, dealing with COVID and other diseases, we do look to researchers to dig our way out of this, to give us hope, to see the light at the end of the tunnel. And so that's what we try to do. We support researchers that are established, but 70% of the researchers we support are in their early careers, and they're looking for their first grant to establish their lab, to stay in the Alzheimer's field. And we need that. We need more researchers. We need more brilliant minds on the case. So right now, we're supporting a record high number at 133 different research projects. All have the goal of better understanding the disease, learning how to better diagnose and treat the disease. And of course, our ultimate goal is to one day have a world where someone is not diagnosed or does not have to live with Alzheimer's disease. So we're at 133 projects now, and it's all thanks to growing funding. We've experienced support from CFC, and I think we've got about like $80,000 that we've gotten from CFC like each and every year, and that's tremendous support. And our research program is focused on supporting all different types of ideas. So we'll focus on genetics and what could be the genetic causes of the disease. We'll look at lifestyle changes that you can be making. We're looking at warning signs such as sleep quality, and how the sleep quality that if you're having a lack of, it could be a sign that Alzheimer's disease is coming. So we're figuring out different clues and different to get a better understanding of how Alzheimer's disease forms and why it's there. So we need support from individuals and other entities to further that research, because research just isn't cheap, but it's one of those long-term investments that you make that always has a huge reward at the end. So I want to thank you for considering supporting our Alzheimer's disease research program.
Thank you, Kathleen. I'd like to go ahead and thank the panelists again for joining with us today with CFC. I'm going to go ahead and go around, and we're going to go ahead and start our questions. I just want to remind the attendees to put your questions in chat, and we will read them through at the end of our session today. Kathleen, I'd like to go ahead and start with you. For our first question, what impacts outside of COVID-19 virus itself has COVID-19 had on the overall health and mental health of our communities?
Yeah, so I looked at a New York Times article that really speaks to this. It was published in July this year in the JAMA Internal Medicine, and they reported that deaths from causes in the United States have increased by 122,000 people from March 1st to May 30th this year, which is 28% higher than the deaths just attributed to COVID-19. So one of the studies that examined this period from March 1st to April 25th of 2020 found that COVID-19 deaths represented only 2/3 of excess deaths in the US during that period, but found that the largest increase in in deaths are from diabetes, heart disease, Alzheimer's disease, and cerebrovascular disease. So this all is to say that COVID-19 has, in a lot of ways, discouraged people from being, I would say, more proactive about their care and avoiding going to the doctor. If they suspect symptoms, or they are afraid of catching the disease, and so when they do come into the hospital or do go into the doctor's office, they're already in advanced stages of the disease. And so so much focus is on COVID at this time, but it is also having a terrible impact on other people who are living with many other diseases, and it's hurting their ability to either see their doctor, or take earlier action to treat their disease or slow it down. So it's it's not a good consequence of COVID-19.
Thank you, Kathleen. It is a very interesting insight that you had mentioned to us in regards to COVID-19, which is, during our times and what we're doing now with everything going virtual, that it really does hit home to many, many people. Nick, the question is the same question for you, is what impacts outside of the COVID-19 virus itself has COVID-19 had an overall health and mental health of our communities?
Thank you, Kathy. I know I can say that for our community and for our athletes, Special Olympics is their escape. It's how they stay active. It's really a large part of their health, both mentally and physically, comes from getting out and competing and seeing your friends and getting to do all that. But once COVID happened, obviously that changed. So the tough part for us was trying to figure out how to engage people and also keep their morale up, where we don't want to do like a half-hour exercise once a day and call it a day, because that's not what they're used to. It's very different for them. And a lot of our population, when things are a certain way, that's what they're used to. So when everything changed, it was tough on them. They don't understand why they can't go out and play with their friends. They don't understand why all of a sudden our big championships are canceled and they can't go compete anymore, because a lot of their identity is wrapped up in our competitions and how they get to compete. So from our athletes' point of view, it took a toll on them. And then on the flip side, for our staff, it took our own toll trying to figure out what we're going to do. And obviously budgets became different. So we had to find new ways to fundraise with new companies who weren't necessarily as impacted by COVID, but a lot of them were. So we had to scramble to try to figure out how we're still going to present our message. And luckily we have a program called Healthy Athletes, where we pretty much like bring a doctor's office to your living room, and it helps our athletes. They learn different dental techniques and how to do their own checkups on themselves and other ways that they can help stay engaged, give them different kind of like brain games so they can work on keeping their mental sharpness as well as their physicality. So when things changed, we had to change with it. And I know it's been tough, but because of supporters like you, we've been able to keep it going and keep them engaged while also keeping them active. And that's just what we're trying to do, is help keep everybody engaged and active, from athletes to volunteers to staff, is just try to keep everybody together while also not being together. So it's been tough, but we're doing what we can and just trying to keep everybody happy.
Thank you, Nick, on your insight in regards to the COVID-19 and how your organization is handling it at this time. Shannon, if you can tell us in regards to the question here of what impacts outside of the COVID-19 virus itself has COVID-19 had on the overall health and mental health of our communities?
Thank you, Kathy. I would say that because of the pandemic around the world, women are finding it more difficult to get routine care and access to the reproductive health services that they need. A lot of clinics have shut down or reduced their hours in places where people already don't have enough access to healthcare providers or to essential medicines and equipment. So in this way, I think the pandemic has really exacerbated the inequalities that existed already. It's also made people more vulnerable to domestic violence and HIV. One of the things that we're seeing too is that the lockdowns and border closures that have been implemented to stop COVID-19 in a lot of places, while they're having a good effect on the containment of COVID, unfortunately, they're negatively impacting both the production of medicines. So for example, at the manufacturer level in places like India, either because the manufacturer is closed or because the raw materials aren't readily available, as well as the distribution of medicines and supplies. So in terms of being able to get those things into countries through customs, that might be closed or understaffed, and then out to the people that need them. And in some cases, this is leading to reversing huge gains that have been made in global health over the past 20 years. I saw a quote recently from one of the major global health foundations that said that in the past 25 weeks, and this was earlier in the pandemic, we've lost 25 years of progress in vaccination rates for children. And that's just heartbreaking. Another, what I would say, conservative quote or conservative estimate from Guttmacher is that just a 10% reduction in reproductive health care globally due to the pandemic results in some really staggering losses, like 28,000 more mothers dying and 168,000 more newborn deaths, as well as 49 million more women left with an unmet need for family planning. So, I think, as I said earlier, the pandemic has really reinforced inequalities in healthcare and in access that already existed. And unfortunately, some of the people that are most impacted are women and children. And so one of the ways that we can help address that is making sure that we find, new and maybe in some cases better ways to keep providing people with the care and supplies that they need during these, really unprecedented times.
Thank you, Shannon, for telling us about how that's impacting your organization during this time. Michael, this is going to be the same question. What impacts outside of the COVID-19 virus itself has COVID-19 had on the overall health and mental health of our communities?
Yeah, so I start thinking about the families that come to St. Jude, that they've heard the 4 words that your child has cancer. And families continue to hear those words even when we do have a COVID-19 pandemic happening. And I think when they hear those words right now, it's probably even more scary to know that they've heard your child has cancer and you're living through a pandemic at the same time. And so when you think about just the overall health and mental health of our St. Jude families and our staff, you're dealing with a challenge that your child has this life-threatening disease. And it not only affects your child, but it affects your whole entire family. And at St. Jude, we know how important family support is to the recovery of their child, to their child beating their disease. And that's why we have St. Jude, we have care teams. And those care teams include our doctors and our nurses, our pharmacists, our child life specialists. And it also helps with, those individuals that help us with music therapy, and our social workers and our psychologists and our spiritual care teams. That is one heck of a care team that we provide to our families at no cost. And that's what's helping with their overall health and their mental health. And I know that they're relying on those resources right now in the middle of this pandemic because it's hard for everyone. And I think overall, every day we learn even more about the overall health and mental health of just how we're all being affected by COVID-19. I think we're learning every day, and we'll learn more in the future as well. And I think we've tried to do continue to provide all these services, and it's helping our families cope and educate, not only on the disease their child's facing, but even on the COVID-19 pandemic. And I can share more later, but some of the fun things that we're doing to make sure our patients are doing okay. It's how do we provide music therapy virtually? How do we provide a fun night, a bingo night for our St. Jude patients virtually? And then even for mom and dad in our St. Jude families that, they're living in a housing facility, and then how do we make sure that they have safe ways to get groceries delivered to them in our housing facilities so they can have a healthy meal? Those are so many things that we think about in this space, and there's so many more things that I look forward to sharing on how we've helped adjust with the COVID-19 pandemic and what we've done so far. So.
Thank you, Michael, for letting us know how that's impacting your organization, but also impacting the children and also the loved ones and the families that are there as well, and how it all circumvents and into what's going on now during this time. I'm going to go ahead and ask the second question to Nick. And the question is how has your organization had to adapt to meet the challenge of this past year?
So obviously everything is virtual now. And like I said, being a sports organization, that makes it tough because it's really hard to do that over the computer. So we've shifted just about everything we've had onto online. I mentioned we have healthy athletes. So for competitions, athletes would show up and get healthcare that readily wasn't available to them. So when we went online, we shifted to this new thing called our Healthy Lifestyle Challenge. And it's every week, 2 times a day. Volunteers go on, staff members go on, and they lead a workout for our athletes. And we get anywhere from 100 to 200 athletes on those calls, just trying to stay engaged and stay fit. So we do that. And we've also done like a fitness bingo, because push-ups and sit-ups aren't fun, but it's a lot better when you can win something at the end of it. So we try to take workouts, make them fun. Virtual bingo is one of our big ones. We've done games with different sponsors where we bring athletes and let the athletes speak, and they love it. The athletes love it. We've done athlete-only games, and oh man, I'm in charge of it, and it's hard to control everyone because they're so excited. Like their friends are all there. It's that connection they've been missing, and everybody comes into the Zoom room and they're all talking, and it's just, it really brightens my heart that we can provide this thing that I've always called, it's just a silly little game, but to them, it's their chance to see their friends and get out there and connect with each other. So we've done that online. We've also shipped out over 6,000 fitness kits to some of our athletes that contain various things like a jump rope, a soccer ball, stuff like that's in there. So that it's all responsibility to make sure they can still compete. So we're trying to give them the tools to do it the best they can from home. And that's what we're trying to do right now. And it's not easy, but every day we're coming up with more and more things that can get people involved. And sometimes people feel they've been doing the healthy lifestyle, they've been doing it a lot, so they get a little burnt out. So Zoom burnout is another thing that we've had to adapt to. So we're always trying to change things up a little bit, from bingo to a scavenger hunt to something else, just so it's still fun, it's still fresh, and people want to keep coming back every week.
Thank you, Nick. That's very interesting, and I can tell you for many of us possibly that push-ups are not fun. But thank you again. Michael, can you tell us how your organization had to adapt to meet the challenges of this past year?
Yeah, no. So obviously the operations here at St. Jude Children's Research Hospital, they look a lot different since the COVID-19 pandemic began. And I think as the pandemic continues to evolve, we continue to adapt and ensure that the safety of our patients and their families and our staff are there. And then we're continuing to deliver, the critical treatments and helping with the research that's needed. And so one of the things I will say is, since March, we began our own COVID-19 testing. We built our own testing program from the ground up, and we are testing, over 6,000 people a week with results in 24 hours to make sure that our staff and our patients are as safe as possible. And with that, we are also participating in various clinical trials for COVID-19 vaccines. And then we've even looked into, just resources and innovations that we've done here at St. Jude because of COVID-19. And that's to continue our commitment of safeguarding our children, not only here in the US, but around the globe, from infectious diseases like COVID-19 and other life-threatening diseases like childhood cancers. And so we have developed 2 registries. One is to help, take a glimpse to make sure that we're tracking pediatric cancer, children that have pediatric cancer and COVID-19. And this is a resource for oncologists and researchers to be able to see the risks and just to see the impact of COVID-19 on children across the globe. And this launched out in early May, and it's already been accessed by healthcare professionals across 100 countries. When we think about COVID-19 here at the US, we've even developed a registry to help track children that have developed COVID-19, so we can see the risks and the challenges that they will face because of this disease. And then even just in resources, so you think about PPE supplies as can be challenging and hard to come by in the healthcare setting, and you never want to have delays or run out in our hospital, and we want to make sure that we have enough equipment, and so our staff was able to utilize our 3D printers to start manufacturing our own face shields because those were in short supply, and those we were able to print those, and they cost less than $1 for us to manufacture those through a 3D printer. Thinking about how you educate children on COVID-19. Here at St. Jude, we developed a coloring book, and it recognizes the importance of how you talk to your children about COVID-19 and how they learn about coronavirus in an age-appropriate material. And then even for teens and tween, adolescents, we've developed a website that helps them learn even in their way about COVID-19. And then even resources for our parents. How do they have the difficult conversation with their children around COVID-19? So this is a ton of things that we've done, not only to keep our patients and our staff safe, but also helping make sure that we're fighting cancer every day and not stopping until we find a cure.
Thank you, Michael. Shannon, I'm going to go ahead and ask you the same question. How has your organization had to adapt to meet the challenges of this past year?
Thanks, Kathy. From an operational standpoint, we've been adapting in new ways like everyone. We closed our physical office so that everybody's remote, and we have postponed travel and put an emphasis on remote training and educational activities instead of doing those things in person. But from a strategic standpoint, we're really trying to make sure that innovative and effective health technologies and services continue to be made available to people. And one of the ways that we can do that while clinics are closed or understaffed or supply chains are disrupted is to introduce self-care methods. And those are methods that women can use without having to visit a healthcare provider. So it helps women to be able to take care of their needs at home. For example, we're introducing a diaphragm in Niger and Benin that is unique in that it doesn't require a visit to a clinic for a fitting. So it's the first diaphragm that can be offered at the community level, where rather than going to a healthcare provider, a community health worker can have that as one of the options available to offer to women. And we're also introducing a smartphone app that helps women to track their cycles, and that's been shown to be 95% effective in preventing pregnancy with typical use. And we're working on that in India, where smartphone usage is really high, and it makes sense to to introduce something like that. So these are just a couple of examples of the kinds of self-care technologies that we're working on, that I think will continue to be good options for women, even when, when hopefully clinics are back to regular hours and supply chains are more like they have always been. We also are looking to find ways of working around traditional systems that have broken down in some cases. So one of the other things we're thinking about is helping to build the capacity of local manufacturers. So outside of China and India and Europe, where a lot of manufacturing takes place, but working with manufacturers that are actually located closer to the communities that we're trying to serve, so that increased localization of supply can hopefully be more sustainable for people in the long run.
Thank you, Shannon. I'm going to go ahead and go on to the third question. If we can go ahead and truncate our response time for just about a minute to where we can go ahead and see if we get if we have any questions from our federal agencies that are on with us today. Shannon, if I can go ahead and go with you on this third question, what are the ways CFC donors can make a difference in health and well-being?
There's so many ways that people are being affected by COVID-19 right now, all over the world, and we're all feeling it. And well-being is such a broad topic. So I think that CFC donors are in a great position, knowing that even small amounts of money can make a huge difference because they're pooled together. And there are also opportunities to volunteer time, which is enormously valuable. And I would say, especially right now, because we as organizations are stretched just like everyone else and are having to adapt to the increased pressure that we're all living in. So there are so many important and relevant causes to choose from, and ways for anyone to feel like they're getting involved in making a difference in something that they feel important about. So I think at the end of the day, any kind of support that you feel strongly about is the best way to make a difference in health and well-being.
Thank you, Shannon. Kathleen, what are the ways CFC donors can make a difference in health and well-being?
Yes, so and specifically for Alzheimer's disease research, I have like 3 examples. So for $2 a week, if out of your paycheck, or that'd be about $104 a year, you can buy personal protective equipment for our researchers, data storage equipment, surgical tools, and cell culture dishes. For $5 a week or $260 a year, you can purchase like this powder that makes a gel that can isolate proteins for several weeks in a biology lab. And it can also purchase a vial of antibody to detect tau in animal models of Alzheimer's. And thirdly, if you're feeling really generous, like giving $20 a week out of your paycheck, you can cover the cost of an experiment that measures Alzheimer's biomarkers or signs in blood samples. So there's all these little ways that you can help further a research project that will take place either 2 or 3 years. Our grants are 200,000 over 2 years, or over 3 years for 300,000. So these small donations though can help purchase a lot of these small things that put together a larger project. So thank you for considering any donation of any amounts that you're comfortable with.
Thank you, Kathleen. Michael, what are the ways CFC donors can make a difference in health and well-being?
Yeah, I think today you've heard from 4 different organizations of the power of nonprofit work and how we're helping change lives of thousands of individuals in so many communities. I think within the CFC, each employee has the opportunity to give back. And I think every little bit is making a difference. I know that's true here at St. Jude Children's Research Hospital. And I think there's ways that you can even help with your monetary gift, but you can help share what you've learned today with some colleagues, with your coworkers. Ask them to make sure that they're participating in giving back and encourage them to give back as well. Um, I will say that, 25 years ago, I was diagnosed with leukemia. I was 10 years old and I was treated at St. Jude. And so those people that give $5 and $10 a month, $2 a pay period, you helped ensure that I had treatment and my travel and food and housing. And my family never paid for anything at St. Jude. And St. Jude saved my life. And so when you think about that $2 or $5, it adds up and you're helping making a difference. So I think there's so many ways that you can give back and you can help in health and well-being. So thank you.
Thank you, Michael. Nick, what are the ways CFC donors can make a difference in health and well-being?
Well, I would say the biggest thing right now is just to be there. Obviously, the monetary donations go a long way. 80 cents of every dollar at Special Olympics goes directly to athlete programming. So anything that comes in through us, it goes to the athlete. We have a thing where you can sponsor an athlete. So for $500 a year, that athlete is taken care of for the whole year. At Special Olympics, athletes never pay. That's our whole mission, is that sponsors help drive what we do. So the money obviously really helps, but right now, more than anything, our athletes just need people to be there for them. With competitions, we had crowds of people cheering them on as they did what they did. And now in the virtual world, it can really feel like you're more alone, that once everything happened, it became athletes and staff, and that was just kind of it. But our volunteers and sponsors play a big role in everything that we do. So we have opportunities like the Healthy Lifestyle Challenge, where volunteers can lead exercises. And it's really good for our athletes to see that the support, even though they can't see it in person necessarily, is that they still see it in some way. So your time is valuable, and we know that our athletes, just by being cheered on, just like, oh, 5 more push-ups, and there's someone back there going, hey, you can do it, you can do it. The little things that help drive them, that's the biggest impact you can make, is just to be there for our athletes.
Thank you, Nick. I'm going to go ahead and turn this over to the federal agencies to see if you can go ahead and utilize your chat function here if you have any questions for our panelists today. It looks like that we're not seeing any questions from our federal agencies. So I'm going to go ahead and end our call for today. I want to thank all to the attendees and also to the panelists for being with us today and to talk about your organization. You all did a wonderful job, and our SoCal team here, we thank you very much for coming on board with us and sharing, talking with us about your organization. Is Jenny still with us? Let me check. I don't see her. Nick, if you can tell her that we thank her for coming along and sharing her story with us. She did a wonderful job, and she's going to be a phenomenal speaker. I mean, she did a fantastic job. So we thank her for coming and sharing her story. So if you can tell that to her from our Southern California team, that would be wonderful.
Of course.
Thank you very much, everyone. I'm going to go ahead and let everybody know here that our next session is going to be December 3rd for animal welfare That's going to be coming up in the next couple of weeks. And so I'm going to go ahead and end our call for today, but I want to thank everybody for being here today, and everyone have a wonderful Thanksgiving and have safety travels if you're traveling anywhere.
Thanks, Kathy, and everybody.
Thank
Bye.
you.
Thank you.
Bye-bye. Bye-bye.